This plate can influence LDL cholesterol, blood vessel function, and even how certain kinds of nausea feel. But the most important word is influence. Online, salmon becomes a heart drug. Broccoli fights cancer. Garlic replaces blood pressure pills. And turmeric supposedly makes inflammation disappear the moment dinner turns yellow. Every claim starts with something real: a nutrient, a plant compound, a laboratory experiment, or a human study. Then the story grows faster than the evidence. One of these foods works mainly by replacing what was on the plate. One spice may help one kind of nausea, but not another. And one compound may become riskier when manufacturers improve its absorption. These are 9 foods that come surprisingly close to feeling medicinal, and the line separating a genuine benefit from a miracle claim. 3 levels of evidence. Before judging a health claim, ask where the evidence lives. Level 1 is mechanism. A compound changes cells in a dish or alters a pathway in an animal. That can reveal what might happen. Level 2 is a controlled human trial. Researchers test whether a food or extract changes a marker such as LDL, cholesterol, blood pressure, or pain. Level 3 is the outcome people actually care about. Did heart attacks, cancer diagnoses, fractures, or deaths decrease? Those levels are not interchangeable. A food can improve one marker without preventing disease. People who frequently eat a food may appear healthier because their entire lifestyle differs. And a concentrated supplement can behave nothing like the ingredient used in dinner. The strongest nutrition evidence usually belongs to dietary patterns, not superhero ingredients. With that map in place, begin with the food carrying some of nutrition's most famous fats. Salmon supplies protein and the long-chain omega-3 fatty acids, EPA and DHA. Regular fish consumption forms part of heart-healthy dietary guidance, and eating seafood is associated with lower cardiovascular risk. Salmon may also replace meats higher in saturated fat, changing more than one part of the meal. Omega-3s influence cell membranes and several processes connected with cardiovascular function. At prescription doses, specific omega-3 medications can lower elevated triglycerides. That does not make a salmon filler a prescription drug. The amount of omega-3 in fish varies with species, farming, feed, portion, and preparation. Fish oil supplements are not automatically equivalent to prescription products, and supplement trials have not produced one universal result for preventing heart attacks. Salmon's strength is quieter. It brings useful fats, protein, and a practical replacement for another entree. Its medicine-like effect belongs partly to what salmon adds, and partly to what it pushes off the plate. Walnuts and avocado. Walnuts and avocado are praised for what they contain, mostly unsaturated fats, plus fiber and other nutrients. Their real power appears during substitution. Adding avocado to a meal already overflowing with calories is not the same as replacing butter, bacon, or a creamy sauce with it. Walnuts sprinkled over dessert do not erase the dessert. When unsaturated fats replace saturated fats, LDL cholesterol can improve. In a 2-year randomized trial of older adults, eating walnuts every day produced a modest reduction in LDL cholesterol. Long-term observational research has also linked avocado intake and replacing certain animal fat foods with avocado to lower cardiovascular risk. Modest is not an insult. Small changes repeated across thousands of meals can matter. Neither food unclogs an artery overnight. Both still contribute energy, and portions count. Their closest resemblance to medicine is not a dramatic active ingredient. It is the controlled replacement of one dietary building block with another. Berries. The blue, purple, and red pigments in many berries include compounds called anthocyanins. Berries also provide fiber, vitamin C, and a food structure far more complex than an isolated antioxidant capsule. Human trials have found modest changes in some cardiovascular markers after regular berry consumption. Depending on the trial and population, researchers have reported changes in LDL cholesterol, vascular function, inflammation markers, or blood pressure. The results are not identical across every study. Some trials find little or no effect. That matters because contains antioxidants is often translated online into prevents cancer, stops aging, or detoxifies the body. An antioxidant reaction in a laboratory does not prove that a berry reverses human disease. The practical benefit is still valuable. Berries can add fiber and flavor while replacing sweets with more added sugar. They do not need to defeat aging to earn a place at breakfast. Broccoli and leafy greens. Broccoli, kale, cabbage, and other cruciferous vegetables contain glucosinolates. Chopping, chewing, and digestion transform them into biologically active compounds, including isothiocyanates. In cells and animals, these compounds can influence processes involving carcinogens, inflammation, DNA damage, and cell death. That sentence is scientifically interesting. It is not permission to say broccoli cures cancer. Human studies of cruciferous vegetables and specific cancers have produced mixed results. Diet is difficult to isolate, intake is difficult to measure, and genetic differences may change how the compounds are processed. Broccoli remains an excellent food because it provides fiber and multiple nutrients in a low-energy density vegetable. Leafy greens add folate, vitamin K, carotenoids, and minerals, but people using vitamin K antagonist medicines such as warfarin generally need to keep their vitamin K intake consistent. Sudden large changes can interfere with the medication. Vegetables support a healthy pattern. They are not chemotherapy hidden in leaves. Tomatoes. Tomatoes are famous for lycopene, the pigment responsible for much of their red color. Processing and cooking can make lycopene easier to absorb, especially when tomatoes are eaten with some fat. That makes tomato sauce a useful reminder that raw is not automatically nutritionally superior. Lycopene has been studied in relation to cardiovascular health and several cancers, especially prostate cancer. But human findings are inconsistent. They do not justify calling tomatoes a cancer treatment or promising that tomatoes prevent cancer. A tomato also delivers vitamin C, potassium, water, and flavor. Sauce can help people eat beans, vegetables, fish, and whole grains. The complete dish may matter more than the celebrity molecule. And depending on the product, tomato sauce can arrive with substantial sodium and sometimes added sugar. The front of the jar says tomato. The back reveals what joined it. Garlic. Crushed garlic and enzymes begin forming the sulfur compounds responsible for its sharp aroma. Those compounds help turn garlic from a seasoning into one of the world's most popular supplements. Research suggests that garlic supplements may reduce total or LDL cholesterol by a small amount in people with elevated cholesterol. Limited evidence also suggests a small effect on blood pressure. Small is the word advertisements frequently remove. Garlic has not been shown to prevent heart disease, and these modest variable effects are not a reason to replace proven treatment. Concentrated supplements also create risks that normal recipe amounts may not. Garlic supplements can increase bleeding risk and interact with medicines, especially anticoagulants and aspirin. In food, garlic has another advantage that no capsule can copy. It makes vegetables, beans, and minimally processed meals taste better. Sometimes the healthiest effect of an ingredient is helping people enjoy the rest of the plate. Ginger. Ginger has been used for digestive discomfort for centuries. Nausea is where modern evidence becomes most interesting. Research suggests ginger may help with mild nausea and vomiting associated with pregnancy. Evidence for motion sickness is weak, and findings for chemotherapy-related or post-operative nausea remain uncertain. Those are different conditions. Combining them into ginger cures nausea erases the question that matters. Nausea caused by what? Most clinical studies have tested specific supplements, not the amount of ginger floating in 1 cup of tea. Ginger can also cause heartburn, abdominal discomfort, diarrhea, or gas. Anyone considering a concentrated product during pregnancy, cancer treatment, or alongside medication should first discuss it with a healthcare professional. As food, ginger brings heat, freshness, and aroma to dishes. As treatment, the form, dose, cause, and patient all matter. The spice beside it on the plate makes even larger promises and comes with an unexpected warning. Turmeric. Turmeric contains curcuminoids, including curcumin, the compound responsible for much of its intense yellow color. In laboratory research, curcumin affects inflammatory and antioxidant pathways. Early human evidence suggests possible benefits for some symptoms of knee osteoarthritis and a few other conditions. But the evidence is not strong enough to conclude that turmeric treats inflammation as one universal disease, or that it benefits every condition printed on supplement labels. Curcumin is also poorly absorbed in conventional forms. Manufacturers often address that problem by adding ingredients such as piperine or by designing formulations that increase bioavailability. Greater absorption is not automatically safer. Rare liver injuries have been linked to turmeric and curcumin products, with risk potentially higher in high-dose or enhanced absorption formulations. Turmeric used to flavor a curry is not equivalent to swallowing a concentrated extract every morning. One is food with a long culinary history. The other is a manufactured dose that deserves the same questions asked of any biologically active supplement. So, can food be medicine? Salmon supplies useful omega-3 fats. Walnuts and avocado can improve the fats replacing other foods. Berries contribute anthocyanins and fiber. Broccoli and tomatoes contain compounds worth studying. Garlic and ginger may produce modest specific effects, and turmeric remains more promising than proven for most medical claims. None works alone. The strongest effect usually comes from the pattern they help create. More vegetables, fruits, legumes, nuts, whole grains, fish, and unsaturated fats, and fewer foods dominated by sodium, added sugars, and saturated fat. Food can support prevention and complement treatment. It cannot diagnose symptoms, guarantee protection, or replace necessary medical care. The plate is powerful because it returns every day, not because one ingredient secretly became a pill. Which food on this plate deserves a deeper video next?